Capstone Project, Chronic Disease Management by Rosemary Lanzalotti at Widener University. Chronic Disease Introduction. A chronic disease is a physical or mental health condition that lasts more than 1 year and causes functional restrictions or requires ongoing monitoring or treatment. As the population ages, people will be suffering from multiple conditions or comorbidity, and it is crucial for nurses to help address these issues in a timely and efficient manner. Chronic diseases include heart disease, stroke, respiratory disease, diabetes, hypertension, arthritis, and obesity, which leads to hospitalization, long-term disability, reduced quality of life, and sometimes death. Chronic disease introduction continued. Chronic diseases account for approximately 2/3 of death in the United States. They are among the most prevalent and costly health conditions in the United States. Nearly half of Americans suffer from at least one chronic disease. Background and clinical significance. According to the Centers for Disease Control in the United States, chronic diseases account for nearly 75% of healthcare spending, or an estimation of $5,300 annually per person. Treatments for chronic diseases cost insurance companies billions of dollars every year. In 2010, the total cost of heart disease and stroke was an estimation at $315.4 billion. In 2012, the total cost of diabetes was estimated at $245 billion. 7 out of 10 deaths are caused by chronic diseases, killing more than 1.7 million Americans yearly. Of the $2 trillion spent in chronic diseases, 75% was spent on public and private health care in 2010. My proposed project will be a training seminar for case manager home care nurses for 1 hour a week for 6 weeks on teaching their patients how to self-manage their chronic disease using evidence-based guidelines, teaching the home care nurses to develop care plans for their patients based on each individual, teaching self-management effectively to support strategies to include assessment, goal setting, action planning, problem solving, and follow-up, educating the patient the importance of adherence to medications. Diabetes education will be teaching how to manage blood sugars with diet, physical activity, and medications. Heart failure education will be educating the patient of the importance of taking all his or her medications at the same time, teaching the patient to avoid getting up too fast from a sitting position to prevent dizziness if taking a beta blocker. If taking a diuretic, educate on the importance of weighing themselves daily at the same time and call their physician's office if a weight gain of 3 to 5 pounds in 24 hours. Respiratory disease education will be educating the importance of oxygen therapy, pursed lip breathing, and adhering to their inhalers. The benefits and challenges. The benefits are patients taking an active, health promotive, and self-managing role due to their nurses' teachings. There will also be fewer emergency room visits and also patients reducing unnecessary phone calls to their physicians. There are also challenges, though, which include public health focuses often on acute problems. Example, controlling infectious disease outbreaks. Also, there's healthcare providers that focus on just care delivery. Neither system focus on the long-term investments in health promotion and disease prevention. My project plan will be the transformational leadership. The project plan will be based on a transformational approach. The transformational leader understands the process of visioning a desired outcome and realizes the opportunities for improved healthcare delivery by way of change within an organization. The leader realizes that vision is fundamental for the transformation of achievement for patients self-managing their chronic diseases. This leader realizes that through collaboration between nurse and patient, there will be better outcomes of self-managing their chronic disease. Implementation change through the transformational leadership. The leader has the ability to improve and is open to ideas. Thus, change will occur for making things better for the organization. Having the skill of improvement tells the organization when problems occur, leader and staff nurses can work together to create these solutions. This type of transformational environment helps employed nurses learn how to bring solution-oriented ideas to the staff instead of complaints. The leader enhances motivation and morale to help connect nurses with their patients, thus change and discourage patients to wanting to make healthy choices. The project plan outcomes. A training seminar taught by a transformational leader will help nurses to teach patients to have more control over their life, which leads to building more confidence to make healthy choices, being active in self-care, and learning how to cope with a chronic disease. It also will have patient satisfaction, improved adherence to medications, maintaining their independence, unnecessary emergency room visits, lower intensity physician follow-up care, and most importantly, cost savings. My conclusion. Patient education is a vital part of nursing care. Teaching patients is an understanding of the learning process and the chronic disease management that nurses engage in patient care daily. The importance on content-based learning is an empowering approach that is showing effects on patient self-management. Nurses need empowerment through continuous professional development. This includes training in delivering patient teaching and working with patients on how to self-manage chronic diseases. It also includes educating nurses to lead them to higher levels of the nursing practice.